Good morning. You are listening to Cutting Edge with Anita, featuring conversations with leading experts from around the world in the scientific, historical, and medical fields, plus arts, entertainment, and anything else that's fascinating. Each week, you'll hear about discoveries and the people behind them. Your host, Anita Finley, is a gerontologist and publisher of Boomer Times and Senior Life. Cutting Edge with Anita is underwritten by Boomer Times and Senior Life, a lifestyle magazine targeted to baby boomers and seniors residing in the South Florida area. For information, go online to babyboomers-seniors.com.
Well, good morning. This is a different kind of a physician this morning. We have had, of course, plastic surgeons and orthopedic surgeons and interventional radiologists. But we're going to talk now with Dr. Mohammed Mirza, who actually helps men with erectile dysfunction. Actually helps women also, but we're going to help the men so they can help the women. So Dr. Mirza is board certified in internal medicine. He's had an extensive experience as practicing clinical physician, and he holds the position of medical director at the Allied Medical and Diagnostic in Clifton, New Jersey. It's very important that we talk with a physician about erectile dysfunction, especially as the population is aging, and we're glad that you are taking the time to talk to us, Dr. Mirza.
Thank you very much. Thank you for giving me the opportunity to be on your show.
Yes, and it is usually we talk to urologists about this. What's given you this extra interest?
Well, in terms of erectile dysfunction, we have about more than 18 million people in the country. So that transforms to about more than 3% of the population. That's a huge number. And most patients with erectile dysfunction, their first clinical interaction is at a primary care level, i.e. an internist, a family practitioner. So, primary care physicians, they are the gatekeepers for, in terms of treatment of erectile dysfunction. So as a primary care physician, my practice has gravitated towards men's health, men's sexual health, and erectile dysfunction. And what my clinical experience over the last decade has shown is, there are a lot of barriers. There are a lot of myths associated with this particular condition. And by the time patients seek treatment, a lot of clinical and organ damage has already been done. And the whole purpose of me and my practice gravitating towards this particular condition is to bring this particular condition into limelight, and not only this particular condition, but the associated comorbidities, the associated co-conditions that cause erectile dysfunction. For example, in my clinical practice, I have seen men coming with erectile dysfunction, but when we do workup on them, turns out that they have a blockage in their heart arteries. So that's a very serious typical manifestation of erectile dysfunction.
Yes. I just want to...
that we want to bring into limelight.
Right. It's very interesting that you talk about this because in my capacity, not only as a radio talk show host, but as a gerontologist and publisher of Boomer Times, I have really been involved with a lot of this. For about 7 years, I was co-host with a doctor down here, and that's what it was. He did the penile injections for it. He also talked about people with radical prostatectomies and a lot of reasons why people did have erectile dysfunction, and yet some of them were, as you said, because they had a blockage and maybe because they had certain things that were very easily repaired. And so men give up too easily, and they're embarrassed, as you know. Now, the one thing I'm interested in, I see you have a clinical care directory called Erectile Doctor. Tell us about that.
Well, Erectile Doctor is a portal, is a health portal, and we have about more than 450 physicians on the platform. And the whole concept or the philosophy behind this platform is to provide our patients with state-of-the-art, cutting-edge medical information about this particular condition, and to give our patients a useful clinical directory so that they can locate physicians in their particular geographical area. one of the things that I have seen in patients with erectile dysfunction, even before they seek treatment with a primary care doctor, their first line of action is to go to an online Canadian pharmacy and start ordering counterfeit, products, and that's number one. Number two,
not good.
Patients, their first treatment of erectile dysfunction, they try to self-medicate themselves, and their first line of action is to stop at an Exxon gas station and buy an aphrodizing product.
Right, so an energy drink or something.
Energy drink. So we want to give those patients the best scientific evidence. Our physicians, board-certified urologists, who are on this particular platform, so they can get the best treatment and not experiment themselves with these aphrodizing drugs or with online Canadian pharmacy.
Let me ask you a question. Do you have any in our area in South Florida?
Yeah, we do have in Florida. I believe we have about, I think we do have, I'm not specifically sure about where in South Florida, but we do have physicians pretty much across board in all the states. We have about 450 physicians. And as we are growing, we are in active phase of recruiting more physicians. And the concept of erectile doctor is not only to treat erectile dysfunction, but to be the platform for men's sexual health. So we are in active phase of recruiting for internists, primary care physicians, endocrinologists. Those are the specialities that deals with men's sexual health. And we want to bring all like-minded physicians who have gravitated towards this particular field or who are already experts in this particular field to be on this platform so that our men, which is essentially 50% of our population, can get state-of-the-art, evidence-based, scientifically validated treatment.
I am so glad I got to meet you. I'd like to talk to you afterwards personally because of what I do, and maybe I can help you do that. This is, we want to have you figure out how we can actually even start a radio show with your doing this. So let's, I tell you what would be good is I'm going to have our board operator get your personal phone number. I don't have your phone number, and then I will call you afterwards. So will that be all right?
Not a problem.
Okay.
Not a problem.
But let's keep talking about this. So now one thing we know, we used to think that erectile dysfunction occurred with gentlemen over 65, but why is it happening in men in their 40s?
Well, there is a direct correlation between the chronic diseases that our society has and erectile dysfunction. The fundamental cause of erectile dysfunction in our population are chronic diseases. By chronic diseases, I mean obesity, diabetes, high blood pressure, inactive lifestyle, being overweight, having a higher waist. Those are the chronic diseases that our society has. And the bulk of our healthcare tax dollars are being spent on management of chronic diseases. The more chronic diseases our society has, the higher will be the incidence and prevalence of erectile dysfunction. When we say erectile dysfunction, our reflex action tells us, it's psychological. In most of the cases, in my experience, it's not psychological. There is an underlying organic cause of erectile dysfunction in most of the cases. So if somebody is, 30 pounds or 40 pounds overweight, he is going to have some manifestation of erectile dysfunction despite being in a younger age bracket. Similarly, if somebody has high cholesterol, one manifestation of untreated high cholesterol could be erectile dysfunction. Now, keep in mind, from a pure mechanical perspective, human erection happens because of the blood flow. Anything that can compromise on the human blood flow, whether it's high blood pressure, high cholesterol, diabetes, obesity, lack of physical activity, can manifest itself in the form of erectile dysfunction. And it's a gradual, slow process.
Yeah, that's very good advice, and I'm glad that you're saying that. The one thing that you said, and it's so true, that someone who now has a problem, and with a few instances where they cannot have an erection, then it does become psychological, and it's a mixture of both of it.
It does become psychological, and that's where, that's the whole purpose of this particular platform, is to seek early treatment. And a lot of the time, I think most of the time, what patients do is, when they have this particular issue, the first thing they do is go online and start reading up, junk material, and start ordering. They are essentially looking for silver bullets for this particular condition. There is no silver bullet. Even Viagra, Cialis, they are not silver bullets. If you have an underlying disorder, you need to fix that underlying disorder to have a long-term solution. It's almost like when somebody has fever, when a patient has fever, the Tylenol that you give to that particular patient for fever is not the solution for the fever. I mean, it's almost like a palliative treatment for fever. You need to address the underlying cause of fever. So, for example, if somebody is having fever because of pneumonia, unless you treat the pneumonia, you cannot just fix the fever. Similarly, just by taking a blue pill, that's not the solution for somebody's erectile dysfunction. You need to address the underlying cause of erectile dysfunction. The patient needs to be thoroughly evaluated, examined, maybe some blood testing, some other ultrasound blood flow analysis. All these things have to be done to really address the underlying cause. And in most of the cases in my practice, what I have seen is the underlying cause are the chronic diseases which our society faces. So, in a way, the platform erectiledoctor.com can potentially reduce the cost of the care, because you are bringing the underlying chronic diseases that our society faces into limelight.
Well, I'm so glad what you're talking about. You're just so smart. I love speaking with you. I was just about to say something about Viagra and Cialis and how that has become so popular. And, of course, a lot of people think that's going to help. And you see these beautiful television ads. And you're absolutely right. First, you have to have a diagnosis of what is occurring. Is it, lack of certain hormones and all the things that you were referring to? In fact, I was just thinking about this, that probably, 20 years ago, we wouldn't even be having this discussion because people didn't want to hear about this. And now, all of a sudden...
People didn't want to hear about it. It's almost like, nobody wants to hear about it. And, the first mechanism is denial, followed by, going to internet and, landing up in a Canadian pharmacy and buying some advertising products. And the other option is, stopping at an Exxon gas station and, buying some junk advertising material, not getting evaluated. Self-medication is very common in this particular, with men with this particular condition. And, the chronic disease never gets addressed. And by the time they come to me, even as a primary care physician, a lot of end organ damage has been done.
And Dr. Mirza, it's interesting, you probably know about us down in South Florida. There are many senior communities, and they pass these pills around to one another because, it helped me or it didn't help me, or why don't you try this? And as we know, people with certain heart conditions could be deadly.
Could be deadly. Now, keep in mind, the number one pill that gets sold in the online world is Viagra. So you can imagine the amount of consumption that is being done through these online illegal pharmacies. So Viagra is one of the top sellers in the online pharmacy world. And it has to be the other way around, where patient needs to come into the limelight, gets properly treated, and then Viagra or Cialis could be part of the treatment, but that is not the silver bullet treatment, but it is being used as the silver bullet treatment without treating the underlying cause. It's almost like somebody is having fever secondary to pneumonia. Don't treat the pneumonia, don't take the antibiotic, just keep treating the fever with Tylenol and you will get cured.
Right.
That's what is happening.
I love this conversation. I'm so glad that I got to meet you. This is Dr. Muhammad Mirza, and he helps men with erectile dysfunction. He's board certified in internal medicine. He's actually had extensive experience as a practicing clinical physician, and he holds the position of medical director at the Allied Medical and Diagnostic Center in Clifton, New Jersey. Let me also tell you that Erectile Doctor is the only website of its kind to provide a discreet, clinical care directory to erectile dysfunction patients in an efficient and private setting. It's a very wonderful thing that this has actually happened because it provides an easy way to communicate with a physician about your erectile dysfunction. Also provides you an opportunity to receive quality care rather than just being forced, as Dr. Mears has said, to seek help from unregulated offshore products or non-qualified professionals, and don't take pills from your friends. I mean, this could be serious, and a lot of you, of course, listening could be in your 50s, you could be in your 80s and 90s, and you may be expecting too much of yourself, and you may also have problems that you wouldn't even have known you had you not had erectile dysfunction. So in a way, it's kind of like when people have problems with their vision, and it turns out that it's really it's glaucoma, but you wouldn't have known it if you didn't have some other examination. So it could be a good thing, but in a way you can get it taken care of, but you have to go to the proper person, and whether it's a urologist or a primary care physician. But a good way to start, I think, is go to the Erectile Doctor website. And what are they going to find when they get there, Dr. Mirza?
Well, it's a fairly easy navigation on the site, and once they go on the site, they can choose the state. And once they choose the state, they will be getting a list of all the doctors on that particular state. They will have a contact form information. They will have the phone number for that particular practice. All they need to do is either fill out the contact information, and the physician will be getting the email, or call that particular practice, make a phone call. The site has been designed so that it's fairly easy to navigate for patients who don't have much of, internet or tech-savvy skills. So, and the whole idea behind that is, you want to make a seamless, easy process for the patients, for the consumers, to locate the physician within their geographical area.
And let me tell you something that I'll bet if you were able to visualize who was going on the site, you would see women going on the site, because women are now getting very interested to be able to give it to their husband, right?
Yeah, we have some data suggesting of women also tracking on our site. And again, I think the approach that one has regarding this particular condition is we need to have a holistic approach where involvement of one's emotional partner can certainly be very helpful, apart from treating the underlying organic disease. So it's almost like a team approach where, the patient is involved, the patient's wife, spouse is involved, and, the primary care doctor, urologist is involved. So you need to have a holistic approach, and depending on the underlying cause, one may have to involve, let's say, a cardiologist or somebody specialized, an endocrinologist, and so forth, and not just treat the erectile dysfunction, but treat the underlying cause of erectile dysfunction, because that's where the problem is.
I was thinking about, you were speaking, I've made so many speeches all over for the last 25 years, and I can go in and start talking about eating properly or exercising or having familial relations. But when I see people starting to nod to go to sleep, I'll say, okay, now we're going to talk about sex. And everyone jumps up, sits up, and they're all just waiting to hear what I have to say. And the funny part, in a book I wrote, Live to be 100 Plus, we really talk about the sexual relationships, and it's not always the penetration. There's a lot of other things to do with it. But the first thing that has to happen is the man has to realize that his partner is a part of this. And first, they become embarrassed. They don't want to talk about it. Now they don't want to have sex because they've had some failures. And it's very difficult on the woman, and it can really destroy marriages.
And the other thing, that has caused a lot of psychological damage is, cheap, easy availability of adult content with just click of the mouse or, on any mobile devices. And it really caused a lot of psychological issues in men with erectile dysfunction. And I believe is a significant contributor, at least as far as the psychological causes of ED are concerned. The kind of adult content that is available with the click of the mouse, it really sets the bar very, very high for an average man. And that is a big contributor towards, ruining the relationships and making very unrealistic expectations.
I would tell you something, and as a primary care physician, you'll enjoy this little discussion. For years, the typical primary doctor, whether he was embarrassed himself, never asked. Maybe they do now, but for years, and I've done research in all this, they never asked, after they took the blood pressure and they never asked, how is your sex life and are you having problems? Do you know that?
Yeah, there is good scientific data that is an area where even physicians are embarrassed to ask, so that never gets explored. And another area which is not being explored is the sexual orientation of the patient. So the sex life of the patient and the sexual orientation of the patient, both two areas, scientific studies have suggested they are neglected areas when a typical physician is taking medical history from a new patient, and there is evidence about that. So you are right on the mark.
Yeah, and I'm so glad. I love having this discussion. We should have you on a lot. We should make this whole show every week. We should have you discuss each particular instance, because I like bringing this out in the open, and pardon the expression, and I know that a lot of people listening, the men and women, we have a big listening audience, that they are interested in this, and the women, as a matter of fact, the older women now sit around when they're playing cards and doing things, and they discuss this. They would never have done this before. They'll say, yeah, well, we went to sleep and he can't do anything anyway, so what's the difference? Well, there is a difference. He's, that poor man is suffering, and we need to help them.
Mm-hmm. Especially from a chronic disease, because the last thing you want is him having some kind of a blockage or untreated high blood pressure, and that can lead to a potentially very adverse healthcare outcome.
Why don't you tell, as in your role as a primary care physician, explain what happens with the blood flow and why the erection does not occur as it gets cut off and it doesn't go down to the penis. Would you talk about that?
In terms of the anatomy of the penis, the way it gets the erection is through quick blood flow. So anything that can cause, it's almost like a mechanical balloon-like process. For a proper, let's say from a layman's perspective, the best way to understand it, it's a balloon and then it needs blood flow to have erection. Anything that can compromise the blood flow can compromise the erection. Now, what can compromise the blood flow? High blood pressure can compromise the blood flow. If you have too much abdominal waste, I see it a lot in quite a bit in my practice. If patients are having erectile dysfunction and they are looking for a Viagra, and I tell them, although I can prescribe Viagra, but the underlying problem is your waist. Because if you are carrying 40 pounds of belly, you are going to have poor blood flow beneath your belly. And no wonder you are having problems with erection. So the treatment is you need to reduce the weight, you need to reduce the belly. We have we do nutrition counseling also in our office. So that's how holistically we approach this particular condition. Similarly, diabetes, especially untreated diabetes, it can damage the nerves of the penis, it can damage the blood flow. High cholesterol can cause blockage of the arteries. Anything that can cause blockage of the arteries can compromise the blood flow. One more unique thing that I have seen in patients with erectile dysfunction, especially in the younger population, are supplements. The supplements that people buy from GMC and any of these, so-called fancy vitamin stores, a lot of them have estrogenic components. And when I do, blood analysis on those patients, I'm at times surprised to see that they have more estrogen levels than what they are supposed to have. And then when you do a more detailed analysis, get a more detailed history, you will find out that they are taking off FDA regulated products in the form of supplements and, taking things from the gym, and none of them is regulated. And that is also a contributor of erectile dysfunction because it is manipulating the biochemical balance that human body has.
You're terrific. I have to tell you, because we haven't really discussed the addition of estrogen coming from supplements and other sources. And I mean, I'd love to sit in, I wish you were here, I'd love to sit in one of your examinations of what you ask people. That we'll have to do that in another show, all the kinds of questions that you ask, because many doctors have not attributed supplementation and things like this to their problems. And another thing I thought it would be good to discuss, and we don't have time on this show, but we can talk about maybe having some other shows, but starting with, of course, what you said, supplements, thinking that they can, get some action from that, and then Viagra, Cialis, and then the vacuum pump, the penile implants, having the shots to bring the blood into the penis. There's lots of things to discuss this whole issue. I'm just so glad that we're having this talk, and I'm sure that your whole that the erectile doctor is a perfect thing. I've never seen that before, and I think is this your idea?
Yeah, that is my idea.
Congratulations.
It evolved through my years in experience, and one message that I would like to give to all the patients is address the underlying chronic diseases that patient has. If you are overweight, take care of that. If you are smoking, one thing we didn't mention, smoking. Big underlying,
right.
big risk factor for erectile dysfunction.
Yes.
So take care of your overall health. That is the best treatment for erectile dysfunction, rather than just, going for a blue pill or an aphrodizing product.
Why don't you enhance that discussion on smoking? I mean, I don't think we hear this from so many doctors, whether it's a cardiac, anyone in all the fields, a pulmonary. I have these people, I work with Cleveland Clinic, I do a lot of these things, and we're always having these discussions. The first thing they say is, stop smoking. Tell me what happens in erectile dysfunction, why smoking is bad.
Well, what smoking does it at a molecular level, it damages your blood flow. It damages your blood flow because it damages the arteries supplying blood to your heart and to your other organs, including but not limited to the penile arteries. So anything that can damage the blood flow can potentially cause erectile dysfunction. So smoking certainly is a big no-no, and smokers certainly have a higher risk for erectile dysfunction. And then when somebody is in the smoking, when somebody has that risk factor for smoking, they have other underlying risk factors also. For example, a smoker, if somebody is smoking, he may have a poor dietary pattern also. He may be consuming a lot of sugar, he may be consuming a lot of fat, and that probably is contributing towards being overweight or obesity, and, that's further multiplying the risk factor for erectile dysfunction.
And maybe I'm going to talk to you again, because I'd like to do some more shows with you on this. I'd like to talk about alcohol. I'd like to talk about, I see where you say a vegetarian diet might be good. So we're just about out of time, and I would like very much to maybe continue these discussions. It's been very, very enlightening. I thank you so much for taking your time, and wish you a very happy holiday.
My pleasure. Thank you very much.
Yes, Dr. Mencia.
Your staff can call me on my number.
I will, Dr. Mencia, and I'm going to have our board operator get your phone number as soon as we... Okay. Thank you so much.
Thank you. Okay. Bye.
Okay, now I want to just tell everybody a little bit about the Boomer Expo, and it's coming up January the 31st on Friday. We want you very much to be there. We want you to be able to participate. We have exhibitors. We're really applauding and appreciating the veterans. So when you're coming there, if you are a veteran, you're going to be able to get into the drawings of $250 each. You're going to be able to you'll receive a certificate of recognition. And we certainly appreciate you so much. But we have a lot of exhibitors. We have a lot of people coming. Don't miss it. Friday, it's January the 31st. You can free parking. The whole exhibit is free. We have 50 premium prizes, gift cards from Macy's, from Saks, from 2J's, the theaters, everywhere. You can't not be here. I mean, I would think it'd be foolish. We have a flat screen TV we're giving away, a cruise for two, weekend for two. As I said, gift certificates to Publix and to movies and all sorts of things. So please be sure to listen to our show next week right here at 8:30 to 9 on WNN 1470 and every Saturday on WSBR AM 740 from 5 to 8. Thank you. Have a happy holiday.